This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Brimaze T Ophthalmic Solution is a treatment specifically designed to lower elevated intraocular pressure. It is effective in managing conditions like glaucoma and ocular hypertension. Indications and uses. This eye drop solution is primarily indicated for individuals suffering from elevated intraocular pressure due to glaucoma or ocular hypertension. It provides a necessary adjunctive or replacement therapy when existing treatments fail to adequately control intraocular pressure. How it works. The combination of brimonidine and Timolol in this solution works synergistically to lower eye pressure by enhancing fluid drainage and reducing fluid production within the eye. Directions for use. For effective use, wash your hands before application. Tilt your head back slightly and gently pull down the lower eyelid to create a small pocket. Then, turn the bottle upside down and squeeze it to release one drop into the affected eye. After applying the drop, close your eye and press your finger against the corner of the eye for 2 minutes to ensure proper absorption. If a dose is missed, reapply it as soon as possible, but avoid doubling doses. Possible side effects. Users may experience common side effects such as eye redness, burning sensations, stinging, and eyelid inflammation. It's important to consult a healthcare provider if these symptoms worsen. Precautions and warnings. This solution is not suitable for individuals with reactive airway diseases, certain heart conditions, or those who are pregnant or breastfeeding. Caution is advised for patients with liver or kidney issues. Always consult with a healthcare provider before use. FAQs. 1. What is Brimaze T Ophthalmic Solution used for? It is used to reduce elevated intraocular pressure in patients with glaucoma. 2. Who should avoid using it? Individuals with allergies to its components or those with severe respiratory or heart conditions should avoid it. 3. Is it safe for children? No, it is not recommended for use in children or adolescents under 17 years. 4. What should I do if I miss a dose? Administer the missed dose as soon as possible, but do not double up on doses. Thank you for watching. If you have any questions or suggestions, please feel free to comment below. Your feedback is always appreciated.